if it works right now, 'cause everything is stupid and crazy, and nothing works like it's supposed to. I don't know why, I don't know why. Crazy Pants Show on the air. Hi, everybody. Welcome. Thanks. It's nice to be here on my own show using whatever software I can scrap together. By God, it's like we've traveled back out in time. So, it's a good time. Right on. Hi, everybody. Welcome. How are you? Hello, and glad to be with you on this fine is it Friday? Jesus Christ. It is Friday. Tomorrow's Sexy Liberal. I haven't been asleep since yesterday morning. So if I'm a little loopy and I kind of go off the rails a little bit, you know why. It's Flurs Day. Yeah, it has to be. It has to be Flurs Day. Somewhere between Thursday and Friday, we just don't know. Back up. When did this man? There he is. He walks in. I'm not gonna let you get away from lumbering in, you maniac. Yes. It's I've got some good stuff for this new one. I'm excited about it. There's a lot of craziness. I also have, because of the news cycle, sort of like extra pieces that I'm at some point going to have to just launch on everyone. The ponytail did not give me a headache. The complete lack of sleep to the point of near torture did, though. Because I'm going to crash hard this evening. Because I got radio tomorrow and the actual show tomorrow night. Been filming and cutting stuff together. And then I'm filming on Sunday as well for the Fiducies. Gonna be a good time. And I've got to take a break in the middle of that to do the hangover brunch. If I yawn, I apologize. It's just gonna happen at some point. But I've been friggin' awake for a good 37 hours, something like that. More than that. Yeah. So, criminy. So yeah, we'll do Kaylee losing her cool as well, but obviously, the former president is going to take precedent. Biden, Trump, Biden. And that's Georgia, by the way, in case you've been wondering. Georgia has been won for the fourth time now. Yeah. Besides, I mean, I don't know if you count every single time the networks called it. Now he has a health plan, you think? Yeah? Let's see. Because I haven't watched this again. I was saying, none of this shit is worth watching twice. So let's check it out. The cameras are going crazy because he's turtling out of his shell. The America First healthcare plan. By the way, he's named this before. They were calling it this a while ago. The thing that she handed to Leslie Stahl was called the America First plan. And this is also, he mentioned the America First healthcare plan and then kept screwing up the name. We'll see if he gets it right.
Thank you very much. This is a very big announcement, the biggest ever concerning drugs and drug pricing.
Yeah, you think? Creation of Social Security and Medicare and Medicaid. You don't think that, all right.
So today I have to tell you it's a great honor for me to announce that my administration is issuing 2 groundbreaking rules.
Executive orders.
To very dramatically lower the price of prescription drugs for the American people, especially for our cherished seniors.
Uh-huh.
We're pleased to be joined on this occasion by Secretary of Health and Human Services, Alex Azar, that administration.
A person you have called an idiot repeatedly, and you demoted from the head of the task force and handed it over to Mike Pence.
Of
This is goofy. Oh, play for pre.
Center for Medicare, Medicaid Services, SEMA, Verma. Thank you both. On this occasion, by Secretary of Health and Human
You guys hear the audio. Why don't I? That's hardly fair.
Services, Alex Azar, and Administrator of Center for Medicare, Medicaid Services, SEMA, Verma. Thank you both. Thank you both. And thank you all for being here. Appreciate it.
Both and all of you. Y'all. Thanks, y'all.
The unprecedented reforms we're completing today are the direct result of the historic drug pricing executive orders I signed in July. Statutorily, we had to go through a very long process.
So we're re-announcing what he's already announced.
And we got it done. I was very proud to have gotten this done. We were pushing it very hard, as we did with the vaccines and other things. The first action will save American seniors billions of dollars by preventing middlemen, famous middlemen they call them, from ripping off Medicare patients with high prescription prices. Currently, drug companies provide large discounts on the price of prescription medicines, including nearly $40 billion in rebates to Medicare Part D plans last year alone.
Right.
Yet often middlemen stop those discounts from going to the patients.
That's because they store them, because these are drugs that are either seasonal or limited in their scope, and people don't need them all the time. So they get the rebate for keeping the drug, and then the drug stays at the lower price, and they get the rebate, but the senior gets the drug at the original price. This is fucking dumb.
Which is what...
Seriously. Seriously? Seriously. They're just hoping no one looks this up?
What we're interested in, not the middlemen.
Uh-huh.
Who need it the most. So the patients are going to be now getting the benefit instead of these very wealthy individuals.
They're not individuals, they're companies.
Patients pay very high prices,
Uh-huh.
and they have for many years, although we brought it down. First time in 51 years, with the costs adding up.
No. 3 drugs went generic during your time in office. You didn't bring down the cost of prescription drugs. Time did.
To hundreds or even thousands of dollars per year per patient. Today's action ends this
Hundreds or even thousands.
injustice and requires that these discounts go directly to people.
Yeah. And then, let me guess. Mnuchin wrote in language that middlemen technically are people, corporations are people. Ask Mitt Romney. So that's good. Okay, so this basically just means that the money can go straight to corporations. Okay, cool.
These are the people that need it.
Why is this weird audio drag?
This will save patients up to 30%. Could be 40%, could be 50%.
Yeah, just keep. Yeah, could be 90. I'd say 120. Why stop there?
Could be much higher than that. These
Sure.
are numbers that nobody's ever even
Nobody's even contemplated. I just made them up. You would think that if you actually created a plan, everyone's contemplated the numbers that are possible.
contemplated. And that doesn't include life-saving drugs like insulin, which will be even higher. Insulin was destroying lives and destroying families because the cost was so high, and now it's at a level that nobody can even believe. Is that correct, Seema?
Yes. Is it because they actually don't believe you? Or because it's actually, you're just talking about Medicare and Medicaid and you're pretending that your EO will provide that to everybody else? This is so...
$35 a month from...
Hold on, back up. Play, you bastard.
$35 a month from many times that number. The second rule, we're fine. Thank you both.
Sorry.
Medicines, including nearly $40 billion in rebates to Medicare Part D plans last year alone. Yet often middlemen stop those discounts from going to the
Often, not always. Case specific. Understood.
patients.
Uh-huh. Well, like, explain one of those
Which is
incidents.
what we're interested in, not the middlemen who need it the most. So the patients are going to be now getting the benefit instead of these very wealthy individuals. Patients pay very high prices, and they have for many years, although we brought it down, first time in 51 years, with the costs adding up to hundreds or even thousands of dollars per year per patient.
Sure, why not?
Today's action ends this injustice and requires that these discounts go directly to people.
People do get the discounts. They just don't end up paying the storage and containment and dissemination fees that they would have to on a drug that barely anyone uses.
These are the people that need it. This will save patients up to 30%, could be 40%, could be 50%, could be much higher than
90.
that. These are numbers that nobody's ever even contemplated.
Why is the audio dropping out on me? It's very weird.
And
Okay, that's from somewhere else. Obviously.
that doesn't include life-saving. And that doesn't include life-saving drugs like insulin, which will be even higher. Insulin was destroying lives and destroying families because the cost was so high, and
You mean the cost of insulin was destroying lives and destroying families? All right.
now it's at a level that nobody can even believe. Is that correct, Seema? $35 a month, from many times that number. The second rule we're finalizing today will transform the way the U.S. government pays for drugs to end global freeloading on the backs of American citizens and American patients. Until now, Americans have often been charged more than twice as much for the exact same drug as other medically advanced countries. We would be having a drug, identical drug, same company,
Sure, tell us.
and we'd pay many times the price of what that drug would sell for in certain countries. In case after case, our citizens pay massively higher prices than other nations pay for the same exact pill
Ask Mitch McConnell why he tried to strip these kind of things out of the ACA.
from the same factory, effectively subsidizing socialism aboard with skyrocketing prices at home. So we would spend
Aboard. All aboard the socialism train. We're going to we're
pay for the same exact pill from the same factory, effectively subsidizing socialism aboard with
socialism aboard. Abroad.
skyrocketing prices at home. So
He's back.
we would spend tremendous amounts of money in order to provide inexpensive drugs to another country.
Yeah, that's not why we do it.
And when I say the price is different, you can see some examples where the price is beyond anything 4 times, 5 times different.
Yeah, because they buy in ginormous bulk amounts.
For example, Medicare Part B recipients are forced to spend 5 times more for a common breast cancer medication than patients in other countries. So 5 times more. And we have other examples that are substantially higher than that.
Yeah, sure, 5 times more, 10 times, 20 times more. What are they? I mean, while Rudy's just making shit up, why not jump in there with him?
To address this unfairness and to lower prices for Americans, we're finalizing the most favored nation rule. Remember that name, most
Okay, I'm remembering it. Most favored nation. Great. Okay.
favored nation rule. Nobody's ever done this. The drug companies don't like me too much, but we had to do it. It took a long time before we were able to do this, because statutorily we had to go through a process. But there'll never be anything like this. I just hope they keep it. I hope they have the courage to keep it, because the
Ooh. That's an admission. Did you notice that? And by the way, this what he did was create this most favored nations concept in an executive order so that it won't withstand any kind of legal scrutiny by a pharmaceutical company or by anybody else for that matter, even these so-called middlemen. So it will be scuttled in the courts by the very judges that Trump put in, and he can blame it on the Biden administration that they couldn't get these things done when they were basically hand grenades he was rolling down a hill at them while pretending to give a shit. You see how this works? If he actually gave a shit about any of this stuff, he'd have worked with Mitch McConnell and the Republicans because they have control of the Senate, and the House would absolutely do stuff on buying drugs in bulk. But they don't want to do that, so he signs an EO that goes out the door. It won't work.
Powerful drug lobby, big pharma, is putting pressure on people like you wouldn't believe. Medicare.
Yeah, he just admitted he lost, by the way. This is the news of this whole thing. Let's be abundantly clear that, watch this. Let's go back.
The drug companies
Oops.
don't like me too.
Why is the audio being
Nobody's
weird?
ever done this.
Here.
Favored nation rule. Remember that name. Most favored nation rule.
Listen to this.
Nobody's ever done this.
And you still haven't.
The drug companies don't like me too much, but
They don't care. They actually do like you because what you're doing is pretending to solve a problem so it doesn't actually get solved. The same thing, it's the same system that Rudy taught you about how you prosecute certain mob families while working for the other mob family, and then you end up mayor.
we had to
It's a
do
great
it.
system. It's amazing.
It took a long time before we were able to do this because statutorily we had to go through a process. But
Listen to
there'll
this.
never be anything like this. I just hope they keep it. I hope they have the courage to keep it because the powerful drug lobby, big
That's it. That's him admitting he's going out the door. That's the concession so far.
pharma, is putting pressure on people like you wouldn't believe. Medicare will now look at the price that other developed nations pay for their drugs.
Medicare will.
And instead of paying the highest price on the list, and we are substantially higher than any other country in the world, we will pay the lowest price. In other words, we take the lowest price and we
No, you won't. That's not how favored nations works. It means everybody agrees on a baseline price. So it raises the price in other countries, lowers it in yours if you pay the most, is the theory. Still, we're talking about Medicare. This is a government act. This doesn't affect anybody who's not on Medicare. It's not going to affect the costs. As a matter of fact, it's going to drive those costs up because that's the way they're going to temper the costs. And unless you pass a law that allows for it to be purchased at that base level, it's ridiculous.
match whatever the lowest price is.
Only in Medicare, right. Which is exactly how the socialist countries you're whining about do it.
Leading to colossal savings for all Americans. And we're talking about savings of 50, 60, 70%, 80%.
20, 65.
Different drugs, different prices.
Sure, different things, different names, different words, different strokes to rule the world.
In addition, today, we're taking one more historic action to hold down drug prices. In the past, drug companies have been allowed to identify certain very old generic drugs that have been widely available for decades and exploit a misguided program called Unapproved Drugs Initiative. That's Unapproved Drugs Initiative, a program that has been around for a long time and hasn't been too good for the
Tell us about it. Hasn't been too good. Explain to us how the unapproved drugs program comes from drugs that were tested for one particular thing, failed at that thing, or were abandoned for a better drug, but had side effects or ancillary effects that are actually therapeutic for other things. And companies would do all the research and pay for all the studies and all that kind of stuff, and then they want to sell this generic drug at a higher rate that nobody uses anymore or that's been basically abandoned. But tell us how you just dug this thing up and suddenly you're anti, Martin Skrilling or whatever his name was.
the people that were supposed to benefit
The people.
to obtain market exclusivity on these medicines. So
Exclusivity. Oh boy. I have to say, dude, you've been resting your lips for 13 days. Exclusivity? Exclusivity. Really? This is how we're gonna do it.
hasn't been too good
Too good.
for the
It's too good.
people that were supposed to benefit to obtain market exclusivity on these medicines. So
Messages.
We are doing something that nobody thought anybody would do. The savings is going to be incredible. Then they've jacked up the prices by as much as 1,000 to 5,000% on.
Okay. 1,000 to 5,000% on an abandoned drug. So what, again, if they're not giving you the real number and they're just giving you the percentage, they're trying to sell you a story. Was the pill, was the cost of the drug itself per milliliter 0.05 cents? And oh my God, it costs 25 cents now? Seriously, exclusivity.
This product.
This is a Hal Sparks exclusive.
On this product.
What? Yeah, exactly. What drugs? Pick one. Break it down. Explain it. You've got screens behind you. Put more than 6 words on them. This is so weird.
This program is also causing
play the
shortages of important medicine.
So very weird. Oh, I know what it is. I know. I understand. I think I get why this is being very strange, don't you know? Audio. Sorry, I have to look at another. Speakers will go to here. That should be it, I would think. Right? I hope I don't get feedback from that. It would be terrible. Oop, it's freaking out. I'll probably wrecked my whole system. I have to say, the overall system update is going to take a little bit to get, yeah.
Today I'm announcing that we are ending the Unapproved Drugs Initiative program to stop this unfair practice. So prices are lifted by 1,000% to 5,000%, in 1 or 2 cases even more than that.
Sure, just make it up. You can always tell when he's like, and others, like, you didn't want to bring it up because it was 10,000% because the drug was free, and 0 times 10,000 is 3.
And we're ending
this is so weird.
this. We are putting an end.
Okay, quit it, you.
To 5,000%, in 1 or 2 cases even more than that. And we're ending this. We are putting an end to it. Together, these reforms will save American patients many, many billions of dollars every single year.
Each.
For generations, the American people have been abused by Big Pharma and their army of lawyers, lobbyists, and bought and paid for politicians. But I've been loyal to the special interests. I've been loyal to our patients.
Huh? I've been loyal to our special interests? Okay, Freudian slip. For Christ's sakes, man.
People that need drugs, prescription drugs.
This is so weird.
And devoted myself to completely fighting for the American
I've been loyal
people.
To our...
And devoted
been loyal
myself to completely fighting for the American people. You see that? This is not an easy thing to do. Big Pharma ran.
Why? Why is it not a bit? You're not doing it. You're signing an executive order in the last year of your presidency, which you could have signed in year 1, but you don't want this done. I signed it in July. We had to wait a certain amount of time before
millions of
it actually becomes a
dollars of negative advertisements against me during the campaign, which I won, by the way, but, we'll find that out.
No, you didn't. Let me guess. You're not going to take questions at the end of this.
Almost 74 million votes. We had Big Pharma against us. We had the media against us. We had big tech against us. We had a lot of dishonesty against us.
Boo-hoo.
But Big Pharma alone ran millions and millions of dollars in ads. In fact, I looked at it. I said, "Who is it?" I've never seen anything quite like it because you didn't give a shit about the ACA and you didn't recognize the ads that were run against it and Barack Obama, and you were on their side before. I told them I'm going to have to do this. I was put here to do a job, and
yeah, and what? Putin wants to undermine our pharmaceutical industry and make sure his is on top, and so you have to gut their bottom line. Is that's what you had to tell them?
Pfizer.
What job were you precisely here to do?
And others.
This is so hype train. Hi everybody.
Job. And
sorry,
Pfizer and others. We're way ahead on vaccines. You wouldn't have a vaccine if it weren't for me for another 4 years
because people would want it to be safe and tested. And never mind that the Obama administration had a vaccine for H1N1 by the end of the year.
FDA would have never been able to do what they did, what I forced them to do. And Pfizer and others even decided to not assess the results of their vaccine. In other words, not come out with a vaccine until just after the election. That's because of what I did with favored nations and these other.
Oh, that's right. Okay, so this is his excuse for why it took so long. This was what he was going to use for why his promises didn't come true, and they planned to secede in July. So the idea is that he signs these executive orders, which benefit the drug companies long term because they're not legislation. There's no permanence to them, and they won't stand up in court, and he knows it, and they know it, and it's a good smokescreen. But it covers his ass since they were saying, dude, we can't get you the vaccine before the election. It might be a couple weeks after is the fastest we can do, but that's how it's going to go. I'm going to sign a bunch of things and make it look like you're attacking me.
Elements instead of their original plan to assess the data in October. So they were going to come out in October, but they decided to delay it because of what I'm doing, which is fine with me because, frankly, this is just a very big thing.
Uh-huh.
A very big thing.
Basically, do you want Joe Biden to come in and tell you it's a big fucking deal? Is that what we're seeing?
I'm doing here, I don't know if anyone's going to appreciate it.
No, I don't appreciate it. Because if you'd actually bothered to do your fucking job and craft legislation based on executive orders that you signed in July, that you could have signed for whatever reason 3 friggin' years ago. Seriously. Were these issues not issues when you became president? The only excuse for signing these things now is because you thought it would be good PR, and you knew by doing them as executive orders and not legislation, you could scuttle them afterwards. It didn't cost you anything, and you could claim victimization against the pharmaceutical companies in your second term if you won. There's nothing. Thank you, Connie.
These people can't even believe it.
Yeah, they don't believe it. They work with you. They've read they know it's a lie.
Alex, even you can't believe it, can you? Look at you.
Alex, you can't even believe I'm saying this. Look at the look on your face. You've read what we've written. You can't believe. Yeah. Ask Peter Navarro about the executive orders on these very things he's talking about. They haven't even filled in the language. He signed empty pieces of paper.
So they waited and waited and waited, and they thought they'd come out with it a few days after the election. And it would have probably had an impact. Who knows? Maybe it wouldn't have. I'm sure they would have found the ballot someplace, the Democrats and the group. These corrupt games.
The group? Who's the group? Who's the group? The Democrats and the group. You know the group, guys?
Games will not deter us from doing what is right for the American people. And I will always put American patients first. And I think it can never be shown better.
You mean first in line for the ICU because you've spread COVID all over the country and we have breakouts everywhere you told people it was bullshit and they bought your line?
What I'm doing today already, we successfully lowered drug prices for the first time in 51 years.
No, you didn't. They just did.
In September, we finalized a rule allowing states, wholesalers, and pharmacies to safely and legally import drugs from Canada. Mm-hmm. Career politicians have promised to institute this reform for decades, and we got it done. The reason Canada, and this is going to be, I think, just a short-term fix, because until we have the favored nations fully ready, which we hope to be in January 1st. I think a very important thing is to say January 1st. It's right around the corner. But I'm giving governors the right to go to Canada because they'll pray.
You mean the socialist country that buys in bulk from other countries, and so they can do the bulk buying on your behalf, so your Republicans can pretend they're not eating off the same calf, basically. I'm not a socialist. I'm just blowing a socialist, is the idea. That's the Republican argument right now.
Pay approximately 50% less for their drugs that they buy for their states. So the governors buying drugs for their states go to Canada. They buy the drugs for very, very much less, and they'll be able to pass that on to the people of Florida. Ron DeSantis was the first one to ask, but others are asking also. And it's a great thing. I mean, you'll save 50%. They're going to buy a lot from Canada.
We've heard this argument before. When he signed it, when he was pushing it, he's mentioned it at the rallies. It's no more true than when he talked about it. But I love the idea that Republicans now get to wander around and get asked questions about why they were against this very thing when the ACA was being debated.
Initially, and I think ultimately they'll be comparing prices. You'll get the lowest price anywhere in the world. So
No, you won't. That's not even what favored nations means.
you won't need to buy from Canada. In a few weeks, my administration will also finalize rules anywhere in the world.
There's always this
so you
layer
won't need
of
to buy
audio
from
where I don't
Canada.
get it.
In a few weeks,
But you guys get to hear it, and I feel bad that you're listening and I'm not listening.
my administration will also finalize rules requiring federally funded health centers to pass drug company discounts on insulin and EpiPens directly to patients, and the EpiPen prices come way down. We remember those horrible stories about EpiPen. Well, the prices now come way, way, way down. We capped insulin costs for many seniors at just $35 a month.
By the way, socialized medicine. That's what they're talking about. He's talking about government control over a particular thing. This is specific to where it is, which means these are federally funded medical centers. How many of you go to those?
I said saving them an
Seriously.
average of nearly $500
Does this
a
apply
month.
to other
As I said,
hospitals,
saving them
county
an
hospitals, St. Jude's? No.
average of nearly $500 to $1,000 a year just on insulin. Saving $1,000 a year on insulin. Since I took office, we've reduced Medicare.
That's the average cost for everyone. You're lowering the cost for the Medicare and Medicaid patients, I'm assuming, as well. But that doesn't affect what other people pay for it. As a matter of fact, it could very well cause theirs to go up.
Part D premiums by 12.
Because they'll be waiting in line. They will be buying something that is in short supply because it will be bought at a cheaper price by DeSantis in Florida.
Percent putting nearly 2.
Oh, and yeah, apparently breaking news, COVID-19 has tested positive for Don
by
Jr.
12%, putting nearly
that was
$2
in the
billion
news.
back into
Really no way
seniors'
to-
pockets. Now, 12% is great by any standard, but 12% is peanuts compared to what we've done with favored nations.
You haven't done anything with favored nations. You actually haven't done it. Your EO sets up a commission to find out why these other countries pay less. And you know why they haven't? Is because they allow their governments to negotiate bulk drug prices. It doesn't affect the other low-end drugs.
I think it's probably the biggest,
It's adorable.
but 12% is peanuts compared to what we've done with favored nations.
Yeah. I
I think
mean,
it's probably the biggest story that we've
probably.
ever had relative to drug prices. There's never been anything like this. This is something that has been talked about for many years, but nobody had the courage to do it.
No, they tried to do it through legislation. Republicans scuttled it. You're doing it as an executive order so you can pretend to have done it, and then it'll get thrown out when the pharmaceutical companies fight it because it has no basis in law, and then that's it. And all you're doing in this part is setting up a commission to want. Why? Guys, I'm glad we've gathered for the Trump Commission on how it is that Canada pays less for insulin and other drugs than we do. Yeah, Gary, I called them. What'd they say? They said they have a single payer system in their country, and that allows them to purchase these drugs in bulk, and the industry gives them a giant discount because they do all the storing, maintenance, and implementation themselves, as opposed to that being left up to the pharmaceutical company. So it basically, it's just like when you buy, Costco versus Whole Foods kind of, is that kind of a balance, boutique shopping versus big box stores. That's effectively, you're sure about this? Yeah, yeah. How'd you find this out? I read a book and I called and I watched the news and ask anybody. Oh, all right. Well, early lunch, everybody, I guess. That's it.
because of the power of Big Pharma. We ended the gag clauses that prevented pharmacists from telling patients how to buy less expensive drugs. As you know, pharmacists could not talk to patients about how to buy drugs. How about that one? Think that's right?
No, they had gags on certain drugs. I think just if there's a generic version, to not bring them up for a period of time. Is that the idea?
And now they can and should.
Your doctor can tell you, though. Oh, thanks.
We
Look at that
approved a
picture.
record
Thanks,
number
guys.
of affordable generic drugs
I don't know what
for 3 years
hold on.
and should. We approved a record number of affordable generic drugs for 3 years in a row, and we put a very heavy emphasis on generic drugs.
Did you? You put a very heavy emphasis on generic. Do you know why drugs go generic? Do you know why? Because basically they're chemical antiques, and they've been around so long that they've aged out of protection as a primary drug. And so you can now have hope. I think we're back up. Hold on. A little better. There we go. A little better. I think so. Jumped back a bit right here. It's hard to say. Maybe am I being throttled? Could it be that I'm being throttled? It's a terrible thing, one being throttled, you know? So, here we go. Let's go. Let's see if we can.
We're paying a fraction.
I have to say, the level of trolls we're getting these days are just not on. They're definitely the B team. I don't know why.
I won't name nations, but I could name 5 of them.
Back this up.
Just staggering, the difference between
Unbelievable.
going to, I won't name nations, but I could.
Do it. Why? Why is this? I don't want to tell you who, but I could if I wanted to. The only
Of them right off the top of my head that it is so incredible to think about for years what
it seems to be. Hold on. Let's see if I can figure out this business while we're here. Hey, how are you? I'm trying to see if I can fix something from my end, that it might be this. No? Hold on. Just hang out with me for a second, kids. See if I can figure out what the issue is. See if it's an internet outage in my area, which is entirely possible. And there's a possibility that this is exactly what's going on. That there's a downage. Yeah. No, there's no outage, right? Uh-huh. It could possibly be the thing. Right. Well, we've smoothed it out. It might just be that it's reacting to the video that I'm putting through. Because when I don't do it for a minute, it doesn't get choppy. Maybe it's being spotty about that. He didn't even file the bill. Yeah, no. Hey, how are you? Twitch went down. All right, let me see if I can jumpstart Twitch. Right. See if that does it. Sending data again. Online. There we are. Twitch is back. Hello. Sorry, everyone. Not sure what's up today. This is getting a lot smoother. Curious that. Bitrate is solid. Frames per second gets a little... What happens when I move? Does it drop down? No, it's okay. No? Right. Keyframes are right. Frames per second is okay. Bitrate's all right. Internet's fine. Does nothing dropped out? Very, very strange. We'll find out. We'll just see. We'll see what we'll see.
Years we've instituted the most dramatic.
And again, there's like this lead up of when I can't hear audio on it. It's really
In
aggravating.
4 short years, we've instituted.
I can't wait till never realized how reliant I was on Streamlabs actually working. Streamlabs, get slobs working on Big Sur.
The most dramatic.
I'm gonna have to get one of the M1 chip computers, aren't I?
In 4
Is that
short
how they do
years,
it?
we've
Is this what they're doing to
instituted the
me?
most
Is
dramatic
this what's
series
happening?
of drug pricing reforms in decades, and you'll see that it all
No, it's not
comes
you.
to fruition right now.
It's
starting
someone
next
else
series of
entirely.
drug pricing
We don't know who it
reforms
is.
in decades, and you'll see that it all
turned
comes
Twitch
to
back on.
fruition right now, starting on January 1st, and the American
try
people will
this.
benefit from our
It might
actions
just
for
simply be.
many, many decades, and it should be very immediate. Now, I presume they'll sue, but it's a suit that they should never be able to win. They should never, ever be able
One
to
moment.
win. So now I'd like
talk
to ask
over me,
Secretary
young
Azar
man.
to provide some.
Sorry guys, I'm hunting for all this. And it might be partly that I, tore my system apart.
More details as to the
There you go.
action. And
Now I can hear. I tore my system apart to do the sexy liberal stuff this week, and I might have pulled a cable there, burned something out. That's entirely possible.
then, Seem, I'd like to have you come up and say few words. And great job. We appreciate it. Thank you, Secretary.
Alex Azar taking his mask off so he can nuzzle in there and give Trump a big old smooch.
Well, thank you, Mr. President. What an extremely exciting day for American healthcare.
Oh, it's very exciting. If only other presidents had the temerity to do executive orders, and if sniping assholes from New York real estate developers didn't crap on them for doing that for years,
On top of the news that you just made, today, Pfizer will
you mean that he came out of his bunker?
be filing an application for an emergency use authorization with the FDA for their COVID-19 vaccine that appears to be 95% effective. Within weeks, we could have a decision from FDA, and within 24 hours of that, we will have started distributing millions of doses of safe and effective vaccine to begin protecting our most vulnerable.
No, you don't know that it's safe and effective. You've shortened the time on looking into those things, and you don't know that it's safe and effective. That's one of the costs of getting one out swiftly. We assume it's safe and effective. It is so far. That doesn't mean it'll stay that way. Trump is very emo right now.
Across America. You know, the president mentioned his passion for getting drug prices down, and I can tell you I've seen that firsthand. When I became secretary,
I've seen him bitch about the cost of green box Sudafed right in front of my face. His dealer came into the Oval Office. I don't know how he gets clearance. And the flake this dude is handing out.
January 2018. The very first meeting we had in the Oval Office was to put together our plan for tackling drug prices. It was
And your solution was to wait 3.5 years and file an executive order?
number one priority, the president said, for us was getting drug prices down. And in that meeting, we came up with the idea for most favored nation status.
Great idea.
And for ensuring that the discount prices that Big Pharma was giving to middlemen would get passed on to America's seniors at the pharmacy counter. And almost 2.5 years ago, in May,
which, by the way, there are zero changes outside the Medicare system in this. Do you notice the ACA provided insurance for 24 million people who aren't eligible for Medicare and Medicaid, who don't have access to Walter Reed. It's for people who have private insurance or couldn't get private insurance. That's a healthcare plan. This is just a budgetary shift in priority for a government medical program that already exists.
The president laid out the most comprehensive vision for reforming drug pricing in American history. The president's
No, this doesn't reform drug pricing. This only has to do with the purchasing power of Medicare and Medicaid. That's it. None of this affects any of the other hospital aspects of in Florida or anything else. The reason it's targeted at seniors and why they brag about Florida is because it's got so many goddamn seniors there. It doesn't work anywhere else. Arizona,
blueprint
maybe.
was clear. We need to put American patients first, and our drug pricing system too often puts them last.
No, it doesn't. It's somewhere in the middle of the European countries that don't have a single payer system. No, yeah.
The blueprint called for tackling foreign free riding, for bringing down high list prices, for reducing out-of-pocket costs, and for better
For anybody who's not on Medicare?
negotiation by our government programs. That's what the president has delivered over the last 2 years already. And that's what the president's delivering today with these new historic reforms.
No, he hasn't. You cannot count drugs that have gone generic in the years he's been president because of a policy that was written 35 years ago.
We're ending a broken system of shadowy kickbacks that drove prices higher and higher every
Shadowy kickbacks.
single year and left so many patients shocked at the out-of-pocket costs that they owe at the pharmacy. We're replacing that system with upfront discounts in Medicare delivered straight to the patient.
In Medicare. In Medicare. If you're not on Medicare or you have private insurance, this doesn't apply to you at all.
The pharmacy counter.
How is this a healthcare plan? This is simply dicking around with the budgetary capabilities of Medicare and Medicaid, a system that Republicans fight all the time.
We're bringing negotiation to the way we pay for the most costly drugs in Medicare.
In Medicare. Come on.
Fixing a system where the government just took the price that drug companies offered, paying about twice as much as comparable countries.
The only reason he's doing this is because he has such a huge goddamn deficit. They've got to bring the prices down and force pharmaceutical companies that Medicare and Medicaid buy a ton of drugs from to sell them at a lower price to patch the hole in the budget he created. Dude.
We're ending a program that's been used by drug companies to jack up prices on older drugs.
On older drugs, right. Which will also eliminate the use of those drugs because then there's no incentive to find alternative use for things if you can't profit off them, so they'll just stay, then nobody will produce them. Why would you make millions or hundreds of thousands of doses of an expired drug that nobody uses anymore for its ancillary side effects if you can at least make back the money that you did doing the testing to make sure it's safe and effective for just that side effect or that ancillary effect?
President's action.
And why wouldn't you sign something like this on day one of your fucking presidency? What was the statutory problem? We've been working on this for 2 years. You've been president for 4.
Today boldly take on the big drug companies, take on the middlemen, and take on foreign countries free riding off of Americans.
They're not free riding off of Americans. They buy in bulk. People who go to Costco are not free riding off the people who shop at Walmart. What the fuck is the matter with you?
If you don't believe how fiercely special interests have fought these efforts, you must not have watched any TV in Washington over the last couple of years.
Yeah, I don't live in Washington. Most Americans don't. What?
Special interests have run millions of dollars in ads against the president's drug pricing initiatives.
No, they haven't. How many, honest to God, guys, how many ads have you guys seen on your TV about Donald Trump is planning on a program that will raise your Medicare? Call your senator and say no to the president's executive order on it. Honestly, I mean that really, because I have seen none. Yeah, I've never seen any of these ads he's talking about. If they're spending millions of dollars, where are these ads? Which ones is he talking about? Cite a single one. Play one. You have 2 screens behind you. You have 2 screens. Play one of these ads. One of them. There aren't any.
Mr. President, they underestimated me, and they...
The ads ran in the D.C. area. Precisely. They're spending millions of dollars in the D.C. area, what, to talk directly to Congress people because they can't afford a lobbyist to talk to people about it? What does that have to do with how does that affect the vote? If they dump, D.C.'s not even a friggin' state. D.C. doesn't have senators. They have, one representative in Congress? 2? What is it? Do you affect the electorate and try to change the vote? What kind of... Seriously, honest to God, listen to the argument these assholes are making. How in the hell do you change the nationwide vote, and especially the swing state votes, by running an ad campaign only in D.C.? How does that pressure Ohioans to vote against Trump? What?
Sure as the devil underestimated you. About 2 years ago, just over in the Roosevelt...
Why would... If they underestimated you? They expected you to do an executive order that can be thrown away.
The president signed legislation to ban pharmacy gag clauses alongside me and his drug pricing advisors. That included my friend and colleague, Dan Best, who passed away 2 years ago this month. And he devoted his life to lowering drug costs for American patients, putting them at the center of our healthcare system, just as President Trump has done. And he was one of the key driving forces behind the rules that we are announcing today. I wish Dan could have been here today, Mr. President, but today's actions are a lasting legacy for him and for you. The president's historic actions will transform drug pricing forever and build the system that the American people deserve. A system...
You mean a government-run pharmaceutical system that purchases, to use the language of the last Republican administration, that picks winners and losers in the pharmaceutical industry? When the government says, well, we've got 14 million people who need insulin, and we've got 1,000 people who need this drug. From a budgetary standpoint, it just does not make any sense to put any tax dollars into that drug for 1,000 people. It's just too expensive. We were not even funding the research. Is that what we're doing now?
That puts American patients first. Thank you so much, Mr. President, for making...
No, it doesn't. It modifies Medicare's purchasing power in theory after forming a commission, and it does not say that you will act on the advice of that commission. Honest to God, that was the executive order on favored nations is the establishment of a commission to figure out why. It doesn't say anywhere in it that you must take the recommendations on how to implement it and make it happen. It's literally an executive order to form a commission and then fold up the commission once you get the answer.
Today, possible.
Okay, not a single detail.
Mask?
Come on, Seema, answer the, yeah. And she's wearing a mask, by the way, you know.
And hoop earrings don't work well. Thank you, Mr. President, for your leadership. And let me take a moment to give some context for today's announcement.
Please do.
From day one, President Trump made it very clear that he wanted to make health care more affordable and accessible to every American. And the
So why did he wait till July of his 4th year to write an executive order and never present a bill to make these very changes law in the entirety of his 4 years as a president? So, honest to God, if it was day one, this is what we're supposed to believe. This is what the maggots and the Trumpsters who are lapping at the trough are all lining up. See, I told you, it says America first. It must be true. It must be true. He wrote the words in the right order. Someone else made a graphic. It must be true. Coke is life. What? Seriously. Where in this, where's the effort in this that changed over time? Thanks, Robert. Where is it? What part of this ever amounted to a Herculean effort that they had to take to finally get these EOs signed? He could have signed these on day one, establishing this. We had to wait statutorily for 6 months or 2 years. I don't know where the 2 years number is he just came up with. That's 2 years ago when the dude passed away, I guess, and he'd been working on it, and they decided to make the programs in his name, maybe. I don't know where he gets the 2 years, but let's say it took him 2 years to get to this moment. Well, if he'd have done it right out of the gate and it was priority on day one, this would have gone into practice 2 years ago. Why didn't you? Why wouldn't you? Seriously, none of this. Literally, this did not require any legislative pushing, nothing at all, no bill crafting. They signed an EO, they're still filling in the details. It doesn't actually amount to anything, and that's ultimately where we are. Because the reality is, if he'd signed an executive order to form a commission 4 years ago, on his first day in office, priority one, I want to lower drug prices for Americans, so we're going to form a commission to see why countries like Canada and Germany pay a lot less for drugs than we do. And they would have formed that commission, and then they would have had to bury the report because they wouldn't have liked what they found out, and it would have required a large government effort to purchase medical procedures, drugs, services for the American people on their behalf. Something the Republicans have been fighting forever. That's why they didn't do this on day one. Because there's no other reason not to. It's an executive order. This is not a healthcare plan. This is an executive order to investigate how to modify the purchasing of a government-run healthcare plan, Medicare. This does not affect anybody who needs insulin and is not on Medicare. Or any other drug, for that matter.
most important thing.
And the gag rule on, I bet you the gag rule on the generic part, that'll get thrown out because it's not legislation.
Is that he wasn't afraid to take on the special interest groups to get this.
He just wanted to wait until there was only 3 months left in his first term so that he could look like he was doing something. And then after he got elected, he could just watch them scuttle the bullshit that he set up so he could give people in Florida the illusion of a reason to vote for him, but then take it back as soon as they couldn't. I mean, he couldn't run again, right?
This goal accomplished. And in the absence of any meaningful legislative support, this administration has delivered real, tangible results. Premiums
No, it hasn't.
down in Medicare by 34%, the lowest in 14 years, and some areas saw declines almost as much as 60%. We stabilized the exchange, lowering premiums.
These are all effects of the Affordable Care Act going into place and growing as part of the system. They're literally now taking credit for things that were caused by the Affordable Care Act.
Premiums for the first time.
Yeah.
And brought back more plan choices. We have set forth a pathway to make the American healthcare system work more efficiently to deliver better quality and lower cost. tackling long-standing problems that no other administration had the guts to do.
Really? Have you read the ACA? Hey, I'm back. Sort of. I had to switch software entirely. That sucks. But it's a little better, I suppose? Maybe? Maybe. Hard to say. But since everything's being, sorry, it's just being wonky as hell, guys. I'm going to, well, hold on. We'll see if we can bring this up. How would I do this? This wants to act up. That is, yeah. So it sees the camera, but it's not showing up in the thing. It's very curious. Very, very curious indeed. It's a mystery. At least I'm in sync, yeah? It's better? Okay. Okay, on Facebook? That's good. All right. Such a good time. I'm going to, let's see. We'll go over here. Create this. See if I can, yeah. Screen capture. Running over here. This is what happens when I have to build a shot live while we're hanging out together. Yes, we're back again. We are back. Hi, guys, we're back. I need to do full resets when this stuff happens. Here we go. Screen capture. New screen capture. Add. There we go. And... ooh, it's slow today. Yeah, I'm going to go with the update on the software was the thing that messed everything up. I have to go with that idea because there's too many screwy things. It's very strange. Okay. System, I don't care. It's giving me a warning that there's no normal ways to send audio to... There we go. Check. There we go. It's giving me a warning that there's no way to be 100% how you run audio into this. Get out of here. I don't want it like that. I want it to be a window. Configure. Bring this up and see if we can make this happen. This will be fun. Yeah, the encoder's being weird across the... Okay, so I'm guessing it's the kernel stuff, the kernel, that's going on in the Mac, and my hope is that they end up creating some sort of... Yeah, this will work. I'm gonna shrink this down. Put bullshit, blow up Barbie's presser on hell. It was hilarious. Excellent. I will. If I can get things working, that's the problem. Everything is touchy today. And I don't know why. There we go. Go back to this one. Take this. What does that do? Let's try this. Squeeze this down. I'm just doing a little modifications, as you do. Now the trick is, can I turn on this one and move me around? Nope. This one? Yeah, that's so weird. So I'm looking, it's just an odd thing that occurs. There's nothing really I can do about it in this currently. Move this over here. Bring this up here. Whoops. Oh, there it goes. All right. Then we put this in. Almost. This kind of looks closer. Man, that took some finagling. Now is the audio playing, though? We'll see.
so that doctors and patients have pricing information when drugs are prescribed so that patients.
Oh, that's good. It's nice when there's a. So screen capture, I have to turn off the audio on that. That's what'll happen. This is the sausage making. I feel like Rachel taking off her mic, but without a touching story. Yeah. So I think this all boils down to it is big tech. They're against everybody. I mean, honestly, who can arrange digital layers on the fly in this situation? I mean, all right. I'm just saying. Now, the frame rate's pretty solid on this one. The question becomes, all right, I'm going to turn this off. Okay, no, there's no audio going into that one. Why would you now? I just feel good hanging out with you guys. This doesn't have to work. We can just kind of chillax. Move down here. All these idiots do is come out and come to the mic and spit out lies. Well, this is what they're supposed to do. If he's going to argue, somebody told him that if you're going to argue that you won the presidency, you have to go out and actually pretend to do the job. Because that, I mean, honest to God, that is the problem that they're running into. You know what I mean? Like they have, thank you, Beth, to defend me from big tech. Oh, bless you. Hi, Lynn. You got here just in time for me to have to deal with, yeah, you have to reload the video, reload the page if I get out of sync. That's something on your end. That's not something I can control. Let's see. All right. And so here.
Can get the best deal. The President's Senior Savings Model has our Medicare beneficiaries cheering this year as they are selecting plans in this year's open enrollment. They have over 1,600 plans that are offering insulin for just $35 a month or less, and that is a massive 66% savings.
66% savings in Medicare on insulin. Now, I'm going to go out on a limb and say that I'm going to guess that the implementation of purchasing of insulin this way was set in motion 6 years ago. And it's gone through a period where the pharmaceutical companies worked in some sort of like ease in on the price, and now it came to be fully implemented, and you're taking credit for it, just like everything else.
Today's announcement is about Part B, where the Medicare program has been nothing but a powerless price taker. And the problem is simple. While there are market forces and negotiations that serve to reduce costs in other parts of the healthcare system, it just doesn't exist in Part B, which pays for drugs that you get in a doctor's office, cancer drugs and other infusions. In Part B, American seniors and taxpayers pay whatever drug companies want to charge. And doctors also get paid a percentage add-on. So the higher the drug costs, the more they get paid, giving an overt incentive to prescribe higher priced drugs. And for manufacturers,
Gee whiz. One would think that you would look at the original legislation for the ACA that had something that defended against this, that was scuttled by the Republicans, and implemented as a bill if you actually wanted to change this practice. You think so? Think it's broadband being hogged? Because I mean, I think we have a league team next door that
prices.
is eating up
and so
bandwidth.
It's no wonder that American seniors are paying twice as much as what other countries are paying. And because of this,
excuse me, the president said it was like 10,000 times.
over the past 5 years, Medicare spending for Part B drugs has gone up by 55% on average.
Terrible.
And drug spending in Part B is responsible for over a third of the premiums that our seniors pay. So the bottom line is higher drug costs lead to higher premiums and higher copays. Doctors do well, drug companies do well, but patients pay more. This effort is going to save over $85 billion over 7 years and saving seniors over $28 billion as well. And so I want to thank the president for being a problem solver, willing to be...
Jesus Christ, this is such an ass-kissing fest. This is so, this dear leader bullshit is so aggravating. You're talking about Medicare. This does not affect the drug prices of anyone who isn't on it. He's just fixing budgetary holes. That's all this is.
to think big and to act boldly on behalf of
Hold on.
the American patients. His
Back up.
record of success
His record is what?
over the last 4 years is a testimony to that mentality. Thank you.
Isn't it?
Thank you, sir. Thank you. Thank you. Thank you.
That's it. Bye. Just left. That's it. Just leaving. Hold on. Turn this off. Go to here. That's at least faster. That's not too bad. I don't know quite why. Yeah, things are very choppy, and I think it has to do with the software update. I apologize, guys. No, there were no farts today in this particular one. I think he just was turtling. So, an ongoing issue with that, as you do. Yeah, my whole computer is slow. So, I've got radio tomorrow, 9 to 11, of course, in Sexy Liberal, so I'm going to need my computer to be firing on all cylinders. So let me sign off early tonight, guys. Sorry, I came on late and I'm signing off early. It's just not cricket. I know. I really do know. I mean, there's a whole new Rudy video out. There's so much. But and I thank you guys for the support or whatever. I will get this fixed. It's hopefully a temporary problem. Yeah, it may require a complete cleanse of a hard drive. So we shall see what we shall see. Let me try and get it up and running. I did update to Big Sur, and I think most of the software hadn't caught up to it yet. Because my computer's set to do it automatically. Yeah. That's my guess. Trump looks like a duck when he's standing. Oh, thank you, Line of Judea. Yeah, I checked a version of that. Yeah, Spotman, also, this is... I'm going to use a lob with this guy. I just put it on temporarily because the other one was acting funky. That's why I was late an hour, because I was trying to fix the audio issue. So, yeah, let me make sure this is all up and running, and I need to, because I need to do a dress down, and I've finally delivered all my stuff for Sexy Liberal so I can actually focus on my stuff, because basically everything was just insane for the last couple of days. And like I said, I've been awake for 38 hours, something along those lines. So, yeah. I thought today is Biden's birthday. Is it not? At least my hair is back? Yes. This is true. I wasn't all wigged up. The computer needs... totally. I do feed to one site that feeds all the platforms. I think it's just the update has eaten how the Mac processes video or changed it slightly, and the software has to have an update to catch up with it. Yeah. So, yeah, I'm gonna work on that the rest of the evening. So hopefully we're smooth tomorrow and for Sexy Liberal, and then regular streams going forward. So, I appreciate you guys putting up with the difficulties that I have running these things, you know. It's a bit weird, bit odd, you know. Not much you can do, but I'll try. And let's see, put this over here. So I will see you guys tomorrow. Yeah, and I will fix the sync issue and all that kind of stuff. If I pop on randomly the rest of the evening, it's because I'm testing videos. So if I pop on and I'm not talking to the chat for long or whatever, it's because I'm seeing if it actually works. And then, you know, so there might be a late night AMA fixing software tonight, because it's the only way I'm going to be able to go through all this stuff and make sure that it's Top notch, top notch. Where, let's see.